for this opportunity. Thank you to the UP College of Public Health for having me. And from one Ramon, you'll be hearing from another Ramon talking about why we need to tackle the climate crisis, the climate emergency, in order to protect the health of
Ramon ni
our
Papa
patients and of human populations. A while ago, you heard that, and you can see it behind me, that I've been advocating for this new powerful concept called planetary health. And planetary health as a concept emerged as a reaction to the inability, and that's unfortunate, the inability of the more familiar concept of public health to tackle these pressing challenges of our time. Climate change, of course, which is the main topic of the day. But also remember, we also have other planetary crises and emergencies that we are currently confronting. Biodiversity loss, land use change. In fact, a month ago, the Stockholm Resilience Center based in Sweden declared and announced that out of the 9 planetary boundaries that have already been identified, 5 have already been violated, including climate change and biodiversity integrity. So we are actually in an era of, that is very alarming. It should be concerning for all of us in the field of public health, medicine, in the business of healing. And that's why the planetary health approach is perhaps the answer to how we can actually safeguard the health of people in the era of a changing planet. I love the college for bringing people, different kinds of people together. Oftentimes, we physicians and public health professionals don't talk to physicists and climatologists. So I really appreciate that we have Professor Drew from the UK and Professor Iliferte to be, discussing about different aspects of the climate. And let me react to some of the main points and messages that they've shared. Professor Drew talked about the Indonesian case study, the challenges that it's confronting when it comes to mitigation, in particular in the energy sector. And this is, not a unique challenge to Indonesia. Many countries, including the Philippines, are facing this problem of, how can we decarbonize while at the same time ensuring that we're able to meet the needs and the demands of a growing people and a growing economy. And we need to cut our addiction to coal for sure in order to stabilize the global climate. But we also need to take advantage and to maximize the numerous gifts of nature that have been given to both Indonesia and the Philippines in order to power our economies using clean, healthy, and green renewable energy. In the Philippines, another country that is so rich with natural resources, we have actually this acronym called BIG SHOW: B for biomass, G for geothermal, S for solar, H for hydroelectric, O for ocean thermal, W for wind. These are all clean, healthy, green energy that exists in the Philippines, but we still have to harness them at a much greater degree. We have a renewable energy law that needs to be implemented. And so decarbonizing the world, decarbonizing our societies and our economies is certainly not just a climate imperative, but a public health and a planetary health imperative. We should all be calling for the phase out of coal and other fossil fuels and usher our successful transition towards green renewable energy. Dr. Villaferte talked about the situation in the Philippines, the climate risks that the country is currently facing and is about to experience in the years and decades to come in an era of a warming planet. We always say that we, the Philippines, are frequented annually by 20 typhoons each year. And of course, we are seeing that number is also changing, and also the landscape of extreme weather events like typhoons and flooding are also altering because of climate change. And he also referred to the UNIPCC report. That report already declared we are on code red. And we physicians and public health professionals, when we hear the word code red, it's a signal that we're in a state of emergency. Are we acting as if we are in a state of emergency in the same way that we are already acting in this era of COVID-19? Greta Thunberg already described the situation as it's as if the house is on fire and people are not panicking. And so these are just some of the challenges, and important for us in the public health community to really understand the climatology of our country so that we can mount public health responses that are adaptive to these changes. Of course, my friend and colleague, Dr. Ronald Lau, who is actually, I would say one of the very few champions for climate change within the Department of Health, he shared with us some of the actions of the DOH, from the policies, the initiatives, the Green and Safe Hospital guidelines, the Green Climate Fund proposal. I hope that we get it. And it's just a demonstration that the Philippines is not starting from scratch when it comes to mainstreaming climate change into the health sector. I think, and correct me if I'm wrong, Ronald, as early as 2000s, we already have the policies, the plans put in place. There used to be a climate and health task force within the DOH that needs to be further strengthened and activated. We're not starting from scratch. And as you've said, Ronald, we can certainly teach the world on how to build climate resilient health systems. But of course, having the policies and the mechanisms is one thing. And I think now we're in the era of implementation. How can we translate our good intentions and our great ideas into
How does that
tangible
mean affects
changes
health?
on the ground, especially at
What
the
are the
local level? As
personal
you said, the
I
local health systems are in the front lines. Just to share with you,
what are
recently we
the
started a new
personal community
collaboration
health
with the
threats?
University of California, San Francisco,
What are the
to
effects
help
of taking
several
your
municipalities build climate
text?
resilient local health systems. And part of it is conducting health focused vulnerability and adaptation assessments, examining their local climate change adaptation or action plans or LCCAP through a health lens, and so many other interventions. So I want to wrap up my comments, and I'm sure during the discussion we have so much to talk about. This is a very big agenda, and I again appreciate the UPCPH initiating this discourse around climate and health. I think in this era of climate change and the planetary emergency, climate change should be central to public health work. It should be central in public health education, not just an elective. It should be taught to every public health professional. It should be central to our policy making. When we discuss universal healthcare, it's automatic. We're talking about how climate proof UHC in the coming years and decades. We're talking also about climate and health practice. How can we incorporate climate considerations in the design and delivery of public health programs? We as academics should deploy all the capacities that we have in academia to generate knowledge and solutions that will safeguard the health of our populations in an era of a changing climate. We already heard about disaster risk reduction efforts, and that's a very good starting point, especially for a country that is frequented by natural, or rather climate-related disasters. From now on, we should stop calling them natural disasters because they're climate-related, and climate change is anthropogenic, human-made because of our emissions. But we need to go beyond this thinking around disaster risk reduction and response, because the climate story is more than just the typhoons. We are yet to see what we call the slow onset effects of climate change, such as sea level rise and how it's going to affect the health of people in the coastlines. We're an archipelago, and therefore this is a priority. Impacts on food security. We will be seeing, if we will not avert climate change, we will be seeing reversals in nutritional gains that we've seen over the past decades. And there's a growing attention around, for example, the impacts on mental health, because climate change is not only going to affect our bodies, it will affect our brains and hearts as well. And also heat health. So a while ago, Dr. Villaferto also talked about the increasing heat or temperature in the Philippines. We're not talking about it yet. And we need to start talking about how we can design national and local heat health plans. And more recently, Athens, Greece just appointed their first chief heat officer. So, and I think lastly, when we talk about improving the health of the population, we also have to make sure that the advancement of the health of the planet is also part of it. So those are just some of my comments and my remarks. Thank you very much, and I look forward to our conversation.